Hi, I'm Julia Burdett. I'm a student nurse at the University of South Alabama, and today I'll be doing a medication administration for heparin. So first, I'm going to go into my medication room. I'm going to perform hand hygiene. I'm going to make sure that my room is quiet, no interruptions, the door is closed. So now I'm going to check that my MAR matches my patient order form. So this is for Mr. Jaguar Jones. Jaguar Jones, his date of birth is 8/25/1963, 8/25/1963. His MR number is 4176352, 4176352, and he is allergic to penicillin, So everything matches. Now I can look at my MAR. He is to receive heparin 5,000 units subcutaneously every 12 hours. So he has not received this medication today. I am going to gather all my materials. So first I'm going to get my heparin. So this is heparin 10,000 units per milliliter. This is not expired. It expires December 5th, 2025. So this matches my MAR. He is to receive heparin 5,000 units. So for this, I'll be giving him half a milliliter since 10,000 units is 1 milliliter. I will have another nurse verify that I've done the correct calculation before I give him the injection. So this is to be given subcutaneously. For that, I will be using a 1 milliliter tuberculin safety syringe with a 1/2-inch needle. All right, so that is a subcutaneous needle. And this is to be given every 12 hours. He has not received it today, and he'll be receiving it at 8 a.m. So first, I'm going to clean off my vial of heparin with an alcohol swab. I'm going to open up my syringe and uncap it and leave it on the table. I'm going to draw back 0.5 milliliters of air and inject it into the syringe or into the heparin. Now I'm going to draw up 0.5 milliliters of heparin. I'm going to recap my needle using the scoop method. I'm going to show you this is 0.5 milliliters. Okay, so now I'm going to check that the medication I've drawn up matches the MAR. So this is 0.5 milliliters of heparin in a tuberculin subcutaneous syringe. This is heparin 10,000 units per milliliter. So Mr. Jones needs 5,000 units. That's why we've got 0.5 milliliters subcutaneous syringe every 12 hours. He has not yet received it today, and he is going to be getting this injection at 8 a.m. So I'm going to put a label on the syringe that has Mr. Jaguar Jones. Jaguar Jones. He's going to receive heparin 5,000 units subcutaneously. That matches his MAR. Okay. And now I'm going to enter Mr. Jones's room. So I'm going to enter the room, introduce myself, perform hand hygiene. I'm going to be checking that I'm with the right patient using his armband and my MAR. So this is Mr. Jaguar Jones. Jaguar Jones. His MR number is 4176352, 4176352, and he is allergic to penicillin. That is also on his MAR. He's allergic to penicillin. So I am going to explain. I'm going to take Mr. Jones's vitals. I'm going to explain to him the procedure that we're doing today, or the injection that I'm giving. I'm going to raise up the bed and lower the side rails and position him comfortably for the injection. This is a subcutaneous injection, so it will be given in the abdomen. It will be given above the groin, below the intercostal margins, and not past the anterior superior iliac spine. And then I'm going to be staying about 2 inches outside of the umbilicus. So I am going to check that this is the right medication on his MAR. So this is for Mr. Jaguar Jones. Jaguar Jones. Jaguar Jones. This is heparin, 5,000 units subcutaneously, 5,000 units subcutaneously of heparin every 12 hours, and this will be given at 8 a.m. He has not received this today, so it is safe to give him. I am going to put on my clean goggles and gloves. I'm gonna clean the injection site with an alcohol swab in circular motion. I'm going to uncap the needle. I'm gonna pinch up the skin, inject at a 90-degree angle. I'm gonna immediately apply light pressure, making sure I don't massage. I'm gonna pull up the safety on my syringe and dispose of it into the sharps container. I am going to remove my gloves and my goggles, and I'm gonna perform hand hygiene. Well, I'm gonna perform hand hygiene now, sorry. I'm going to lower the bed back down and raise up the side rails and then position Mr. Jones comfortably again. Before I leave, I'm gonna note that make sure that he's not having any reactions to the injection. I'm also going to come back within the allotted time period and check again that he's not having any reactions to this injection. And I'm going to fill out on his MAR that he received heparin 5,000 units subcutaneously every 12 hours. He received it at 8 a.m. and he did not have any reactions. I'm going to sign by, put my initials by that. And that's it.